Hello everyone. Today we will be covering a pediatrics topic which presents with swelling in the head. Okay. It includes three conditions which is Caput succedaneum, cephalohematoma and subgaleal hemorrhage. Caput succedaneum and cephalohematoma are the most important and we should know how to differentiate between the two. So we will start with that. Cephalohematoma is more common as compared to Caput succedaneum is more common as compared to cephalohematoma. Okay. We can remember few details about Caput succedaneum with the help of cap. ठीक है. Cap is something that we wear superficially, so therefore it is superficial. ठीक है. Subcutaneous location, and cap is something that we wear diffusely over our head. ठीक है. आधा part we don't cover with the help of cap, completely पहनते हैं. Therefore diffuse. तो diffuse, superficial and subcutaneous location. In contradictory, cephalohematoma is deep. It is subperiosteal in location and most common bone is parietal bone. Parietal bone के ऊपर का जो पेरियोस्टियम होता है उसके नीचे इसका हेमाटोमा होता है. ठीक है. जो कापुट सक्सेडेनम है इट इज ड्यू टू प्रोलॉन्ग लेबर. ठीक है. व्हेन देयर इज अ प्रोलॉन्ग लेबर there is pressure over the head region of the baby, therefore which leads to congestion of the veins leading to edema. So therefore this is superficial. ठीक है. ड्यू टू प्रोलॉन्ग लेबर, कंजेशन ऑफ वेन एंड कॉजेज एडिमा. वेराज cephalohematoma is seen with instrumental delivery, mainly forceps delivery. So while delivery, if the forceps hits a part of a skull which most commonly hits near the parietal bone, ठीक है, it leads to trauma to the skull. तो वहाँ पे फ्रैक्चर होगा, ब्लीडिंग होगा, जिसके वजह से ये हेमाटोमा बनेगा. ठीक है. नेक्स्ट इज Caput succedaneum, as we have said, it is edema. And edema मतलब क्या होता है? Edema is a fluid. तो यहाँ पे fluid accumulation होगा, यहाँ it will be blood. ठीक है. Caput succedaneum develops soon after the birth, very fast development. Whereas in case of cephalohematoma, there is a less space present between periosteum and bone. It is a tight region. Therefore, for blood to accumulate there, it will take some time. Therefore, it takes 12 to 24 hours after birth. ठीक है. Then it disappears by 2 to 3 days. ठीक है. Whereas cephalohematoma disappears by 3 to 6 weeks. Caput succedaneum is a very benign type of condition. It resolves by itself. Therefore, there is no association present along with it. Whereas in case of cephalohematoma, 5 to 25% of cases show linear skull fracture. Okay, linear skull fracture is present. And jaundice is seen. Jaundice is due to hemolysis, the blood which gets accumulated there. Lysis takes place and उस वजह से jaundice होता है. ठीक है. Then the final topic is subgaleal hemorrhage. Subgaleal hemorrhage is most severe type. ठीक है. Subgaleal is galeal aponeurosis जो होता है, स्काल्प का एक लेयर होता है, galeal aponeurosis, जहाँ पे frontalis and occipital जो occipitalis muscle जो है they come and fuse and form an aponeurosis. उसके नीचे blood gets accumulated, वहाँ पे hemorrhage होता है. तो beneath galeal aponeurosis, ठीक है, it is associated with vacuum delivery. ठीक है. तो ये तीनों के एसोसिएशन पता होना. इफ इन अ क्लिनिकल क्वेश्चन देयर इज गिवन कि आफ्टर प्रोलॉन्ग डिलीवरी, देन फर्स्ट थिंग दैट शुड स्ट्राइक योर माइंड इज Caput succedaneum. इफ इट इज गिवन इंस्ट्रूमेंटल डिलीवरी स्पेसिफिकली फॉरसेप्स, देन cephalohematoma. एंड अगर वैक्यूम असिस्टेड डिलीवरी बोला है देन इट इज subgaleal hemorrhage. ठीक है. इट इज ऑल्सो डिफ्यूज एक्यूमुलेशन as seen in Caput succedaneum. It causes hypovolumic shock because the amount of blood which gets accumulated over here is comparatively very large as compared to the above two conditions, जिसकी वजह से circulating blood volume reduces, therefore hypovolumic shock plus blood volume कम हो गया, therefore pallor, and यहाँ भी hemolysis होगा later stages में, leads to jaundice. ठीक है. I guess I'm pretty clear this time. Next, ये सिर्फ explain करने के लिए, just a second, see. The layer I am marking is ये सबसे वाइट वाला, दैट इज स्कल. उसके ऊपर जो येलोइश कलर का है दैट इज पेरियोस्टियम. ठीक है. अबव दैट द पर्पल कलर लाइन इज अपोन्यूरोसिस, जो गेलियल अपोन्यूरोसिस है वो, एंड ग्रीन वन इज स्किन. ठीक है. सबसे पहला बेनेथ द स्किन, ये जो है दिस वन, दिस इज Caput succedaneum. ठीक है. दिस इज फॉर यू टू मार्क, आई हैव नॉट मेंशन्ड इट हियर. Next is below the aponeurosis, then it is subgaleal hemorrhage, and the final one between the bone and the periosteum, that is cephalohematoma. ठीक है. This is cephalohematoma, this is subgaleal hemorrhage, and this is कापुट सक्सेडेनम। ठीक है, चलो दैट विल बी ऑल फॉर टुडे। थैंक यू।